Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We're talking today about the epidemic of diabetes. And Dr. Prather, what is meant by the epidemic?
We call it an epidemic?
Yes.
It's actually not an epidemic, it's a pandemic.
Ah.
Which is even bigger than an epidemic, but most people don't know what pandemics are.
Mm-hmm.
So it's the fastest growing disease in America.
Wow.
So the Center of Disease Control said this is becoming the number one problem that people are experiencing, and it is going way beyond any other type of disease growth. So we've got a real problem with diabetes, and it's something that needs to be addressed and needs to be taken care of.
So why is diabetes such a fast-growing problem?
Well, there's several different factors that go into it. One that kind of feeds that is the obesity crisis. So, we were...
No pun intended. Did you catch that?
Yeah. It's a weighty problem. But yeah, the obesity crisis is one of the biggest things that's fueling it. And then, of course, the sedentary lifestyle. So, when we were going back into the 70s when they started to take numbers, there was only one state, Mississippi, that had over 10% of its population obese. And all the other states were under 10%. And then at this point, now that we're testing it, I think Colorado is the lowest on the obesity rate, and it's 25%. We have some states that it's 60%.
Over 50%.
Over 50%.
Wow.
So we've got a real crisis on the obesity, which is creating a tremendous amount of problem. And then also sedentary lifestyle. We're spending more money on exercise stuff, but I don't think anybody's using it. Everybody's spending more on diet stuff, and it doesn't seem to be working. So there's a very big problem, and are we seeing that problem over in Europe? No. Are we seeing it in other countries? No. So it seems to be a problem that's really located here in the United States that we're not addressing correctly, obviously. And it needs to have some very basic social changes to get this under control and understand why is this happening.
I was just with a group of women, and we were talking about one of them had worn her mother's wedding dress. And, you think 2 generations back, the woman had such tiny waists.
Yes.
You don't hardly see that anymore.
No.
No. She was talking about how she couldn't wear that dress and they had to expand it, so she could wear it. But, I was thinking we don't see the tiny waists anymore that women have.
One of my daughters, because my mom had saved her wedding dress, and my thinnest sister said that...
Yeah, you said daughter.
Yeah, well, I mean, not my daughter, but her daughter, my sister.
That's true.
And she said, well, maybe, I could see if I could wear your dress. And she said, oh, honey, you couldn't fit in mine. And my sister laughed and tried it on. She says, I can't fit in yours. Your waist was tiny.
Yeah.
And that was a much more common type of thing to see, is those tiny waists in women that just aren't there anymore.
And we're going to talk about, why that is and what it is in our food and diet here in the United States. And you're saying in Europe they're not seeing that, but if they take on our diet,
correct,
they're going to start.
When they start doing our American diets, then that's when things actually get really bad.
Well, let's talk about what is diabetes.
Well, diabetes is, of course, getting the body down to glucose because that's a fuel that makes the body run. And the body should be regulating keep the glucose at a pretty even level. And it does that. One of the major critical factors is insulin. That's one of the main things that gets the glucose into the cell. And we are right now not able to control our glucose levels. So when you can't control your glucose levels, things go out of kilter on that. The body has to do something with it. Otherwise, it starts to raise and it starts to damage the body. So it damages the circulatory system, it damages the muscles, it damages the nerves. So oftentimes it will convert that glucose into fat, because it doesn't have anything else to do. It should be converting that into storage in the liver, glycogen. on the excess, but we are no longer able to regulate it as we should. And as it goes out of kilter, then we start to talk about it as a diabetes. And they got the term diabetes from honey, Greek term for honey. And so when the early physicians were trying to figure out what was going on, they would actually taste the urine as one of the diagnostic tests that they would do.
Oh, interesting. Aren't you glad they stopped that?
Yeah. I'm glad we have test strips now. And it was sweet like honey. So then they got the term diabetes.
Oh boy, that is an interesting fact.
You look like you're going to gag.
Our listeners out there, going to share that fun fact at their holiday parties. So are there different kinds of diabetes, Dr. Prather?
Yes, there are. Of course, the main thing is what's called diabetes mellitus, and that is by far the vast majority of diabetes. There's gestational diabetes. That's when a woman's pregnant and all of a sudden can't control the blood sugar. So there's that issue. There's diabetes insipidus, which is a pituitary problem. And then there's pre-diabetes. The really big problem is the diabetes mellitus. And there's two different kinds on that. There's insulin dependent, which used to be called type 1 diabetes or juvenile diabetes, because it almost always used to happen only in children. And that's when the body actually destroys its own ability to make insulin. So there's a damage to the islets of Langerhans in the pancreas, and as that occurs, then the body can no longer make the insulin that's necessary. And then you also have non-insulin dependent diabetes, which is really 95% of all diabetes mellitus. Only 5% is type 1. And that's the area that is growing very, very quickly.
Is that considered type 2?
That's type 2.
Okay.
And that's a non-insulin dependent diabetes, and that's the main diabetes that is growing very, very rapidly in the United States. And that's the one that's causing the main problems.
Okay. So how many Americans are diagnosed with diabetes?
Well, there are 23 million Americans diagnosed with diabetes right now. But there's actually 35 million people who have diabetes. So there's quite a few people who aren't diagnosed. As many, they estimate as many as 12 million.
Wow.
So it's...
Is that just because they don't go to the doctor, or...
Yes, one of the things is that diabetes doesn't necessarily have a lot of symptoms that are involved. So as we find that quite often, where we're talking to people, talking about some of their symptoms, we say, we need to really check for diabetes on this. And we discover that they are actually diabetic. So that's a very common thing that we have in our office. So, yeah, people need to be aware. That's why everybody should have a yearly exam. And one of the things they should be doing is checking to see if someone has diabetes.
That's real important. So what is pre-diabetic then?
Pre-diabetes, basically when you're diabetic, it's when you've reached a certain level of not being able to control your blood glucose. So it reaches at that point, and then it's diabetic. But there's an awful lot of people who are sick before that are experiencing pre-diabetes, which is that their blood sugar is not regulating normally. And they're not completely where they would need, medication, but things aren't working well. And that's actually causing quite a few health problems, because that does contribute to different types of diseases. Cardiovascular disease certainly contributes to the obesity. And that's a really, really big growing problem. And one of the things that the World Health Organization and the Center of Disease Control said that we're really ignoring the pre-diabetic condition, and that's really where we need to be starting to treat people.
Yeah, the prevention.
Right.
And so how many people are pre-diabetic?
Well, that's the shocking number. It's about 80 million people.
Wow.
That they estimate are pre-diabetic.
That's not including type 2, type 1. That's just pre-diabetic.
No, we've got
That's a pandemic. That's what you said.
Right. We've got 35 million people who have diabetes. Only 23 million people know that. And 80 million people is what they and I find that very true, because we're constantly telling people. Matter of fact, there are more people that come into our office that are pre-diabetic that aren't.
Wow. Interesting. When we come back, more on the epidemic of diabetes. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. So when a person goes to their doctor, how does the doctor know if it's a virus or a bacteria?
You do a blood test. You do swabs. There are lab tests. And matter of fact, one of the things, the way that you're supposed to use an antibiotic is you're supposed to get a culture of the bacterial. And then you're supposed to grow it. Then you're supposed to put the antibiotics on there to find out if it's actually going to work before you give it. There's a whole natural procedure that you're supposed to use for bacterial infections. In the meantime, it's not that you're completely helpless. And that's one of the problems that we have with many of the physicians. Well, they have an infection, I have to give them something. And one of the things that we've done in modern healthcare, we haven't given the physicians the tools to be able to work besides the antibiotics because they weren't encouraged to give vitamin A, they weren't encouraged to give vitamin C, they weren't encouraged to give vitamin D. Iodine works on bacterial and viral and fungal. So, the iodine, gold, silver are all antibiotics. You can help to drain the lymphatic system with echinacea. You can boost the ability of the body to fight viral with olive leaf. There is a whole host of things that can be done, and we have restricted the physicians from doing those types of things, which is called structure function care. And then have only allowed them to use harmful pharmaceuticals that only should be used in certain cases. So we've changed the whole course of healthcare, and because of that, we've created a monster. We are in a healthcare crisis. Nobody doubts that. The answer to the healthcare crisis is structure function care. One, it's been proven that we can cut down on the cost of healthcare overall by 60%, and we've been shown that we can improve through structure function care the outcomes of healthcare by 85%. These are numbers that have been proven, and this has to change. We have to have structure function care as the primary care and the first line of defense. Then we go to the pharmaceuticals afterwards.
Right. The answer's already there.
The answer's there.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about the pandemic of diabetes. And Dr. Prather, those numbers that you were sharing are astounding. 80 million people, and we're just talking about the United States.
Just the United States, yes.
Are pre-diabetic.
Pre-diabetic,
But of those, how many people know they're pre-diabetic?
Less than 10%, so about 7 million is it.
And why is that?
Well, it's interesting because we have people come in, they had seen their doctors, and we looked at their blood tests, and we sit there and say, well, what did your doctor say about your pre-diabetes? And he said, what do you mean? And I said, well, you're pre-diabetic according to your blood work. And they said, well, the doctor didn't talk to me at all. He just said I wasn't diabetic. And you can't, the time to really treat diabetes is before it becomes diabetes.
The pre-diabetes.
And because everybody, it's very seldom that somebody just all of a sudden become type 2 diabetic. Type 1 diabetes happens rather quickly. But type 2 diabetes usually takes a while to develop. There are some exceptions on that. but there's usually years in the process of becoming diabetic. And if people know that that's where they're headed, then there's quite a few different types of things that they can do. Well, as a matter of fact, type 2 diabetes is completely preventable and actually curable. If they do the proper type of things, head in the proper direction, look at that, and you can actually see the changes that take place that prevent the diabetes from occurring. So very definite steps that need to be done. And it is something that the Center of Disease Control has said, look, doctors, you're woefully undertreating this. You need to get started on working on people, definitely when they're diabetic, but you need to be working on them when they're pre-diabetic. And really, pharmaceuticals, if you have to go in with pharmaceuticals, then it's a failure. This is something that should be taken care of in lifestyle type of way of doing it, and it's very, very workable.
Yeah, and you're saying that, and 35 million people have type 2 diabetes.
Yes. 35 million
that could
people.
Be preventable.
That certainly would have been preventable, and it is something that we see quite commonly, where people are, become no longer diabetic.
And we're going to talk about that further in the show. But let's talk about and you might have touched on this a little bit, but what is the difference between type 1 diabetes and type 2 diabetes?
Well, type 1 diabetes is an autoimmune disease where the body has, where the antibodies have attacked the cells that make insulin in the pancreas. So oftentimes that's kicked off by some type of a infection. It can be a medication. It can be several different things that kick that off. Most commonly, it's a virus. The most common virus is Coxsackie B. So if you can be looking at those types of things and working with kids, you can actually prevent that type 1 diabetes from occurring. But type 2 diabetes is something that is usually adult onset. It's usually kicked off by obesity, lack of exercise, poor eating habits, having a high glycemic diet. Those types of things kick off the type 2 diabetes. And that is something where the body can be making plenty of insulin, but it's just not being able to process it.
Okay. So what are the symptoms of diabetes?
Well, the symptoms of diabetes, they call them, the big thing that they do is they call it the 3 Ps. Okay? Polyuria, polydipsia, and polyphagia. So polyuria is urination. You feel like you do urinate quite a bit, and then you feel like you need to urinate because what you're doing is the kidneys are actually getting rid of the glucose. Remember, there's too much glucose going on, and the body has to do something with it, so it filters it out through the kidneys. So you have massive amounts of urine that goes out, which increases the urine output, and so you're constantly feeling like you have to pee, and you do. The other one is that you're thirsty all the time. So you need to put a lot of water because what you're trying to do is to dilute the blood sugar. So the more water you drink, the body's just saying, hey, drink more water, drink more water. We need to dilute this glucose that's flowing through the blood. And then polyphagia, you become really hungry. Because you're not able to get in other words, the glucose isn't really getting into the cells, so you have this constant hunger that actually occurs. Now, some of the other things that happen along with that is actually weight loss. When you go into type 2 diabetes, believe it or not, because you're not able to utilize the glucose properly, you start to lose weight because the cells are starving. Then you also have a lot of skin issues. There can be skin infections. There can be discolorations in the skin. A lot of problems along those lines. And then a lot of infections, especially urinary tract infections. Fungal infections on the skin start to occur quite a bit. So those are some of the other things that can occur. But oftentimes, most of the people aren't even aware that there's a little bit of increase in urine that they notice. There's a little bit, I have more urinary tract infections and I'm thirsty all the time. We hear that quite a bit, but people don't really associate that necessarily with the diabetes. Now,
I was just a little confused. I want clarification because obesity, and then you said people lose weight.
Yes, and that's one of the odd things because it's the obesity that kicks off, is one of the big things that kicks it off. But then once you go into the diabetes itself, where it becomes damaging, then they start to lose weight. And matter of fact, we've had several people who sit there and say, well, all of a sudden I started to lose weight. I'm not quite sure what it is I'm doing because I'm not really doing anything any better. And that's one of the red flags for us.
Okay. They know it's not a weight loss program.
It's like, if they start to lose weight, they haven't changed their diet, they haven't started exercising, we go, okay, there's something wrong.
Check. Okay. So who gets diabetes?
Well, you can get diabetes almost at any age. So type 1 diabetes is usually found in children. That's where the reactions occur. But it is more common now to develop that in adulthood.
Why is that?
They're not quite sure.
Okay.
Everybody's health is kind of falling apart. So some of the old rules that used to apply no longer apply. So it is much more of a problem. But type 2 diabetes, it can occur at any age. It really starts to kick in about 45. But the older you get, the more likely you are to become type 2 diabetic.
Okay.
Just because the body starts wearing down over a period of time.
So what other conditions develop from diabetes?
Well, you can have neuropathy, nephropathy, and retinopathy. Lots of
apathies.
And that just means it's a pathology. In other words, it's sick. So, it's the nerves are sick is what neuropathy means. So the nerves start to die. And they usually start in the feet and the hands and fingers, and then it spreads to the rest of the body. So the nerves are poisoned.
The extremities.
Yeah, the extremities, and then works its way in. So that's what neuropathy is. And it's a very, very devastating type of thing to have. But that is one of the big things that occurs. Nephropathy, nephro is the kidneys. So you have diseases of the kidneys. Remember, it's trying to get rid of all the glucose, so it puts a lot of pressure on them, and it can actually start to damage the kidneys. And then retinopathy is the eyesight. So changes in eyesight is another thing. It can kick off on whether you have type 2 diabetes, is that your vision starts to change. And it can actually lead to blindness if you don't take care of it. And some of the other things that occur is cardiovascular disease. Increases the risk of that extremely. Matter of fact, that's one of the major things that occurs. And then also you can get cancer, have an increased chance of cancer. One of the main reasons that all that starts to occur is something called free radical pathology. And diabetes increases free radical pathology quite dramatically because of the free radical pathology occurs when the oxidative process, when you're making energy, you need the glucose to make energy, and that whole process is disturbed. So when things go wrong, the oxygen molecules start to kick off the electrons, free electrons, starts to damage the body. That's why they call them antioxidants, to try to absorb the electrons that are kicked off and stabilize the oxygen molecules.
Interesting. Yeah, and you talk about free radicals a lot.
Free radicals are probably one of the biggest things. If you had no free radical damage in your life, you would look like you're 21 the rest of your life. You would never age. So it's the free radicals that cause the aging. And like what I was telling one guy is that the free radical damage is what happens to a rusty gate. He says, because we had found that he had that. He says, okay, that's exactly what I feel like.
A rusty gate.
Like I'm an old rusty gate. And he said, so this is the reason why. I said, yes, and if we can get this down, that rusty feeling is going to be gone.
Okay, when we come back, let's talk more on the epidemic of diabetes and how it affects life expectancy. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I love our holiday traditions, like the Christmas tree, where we go out and we chop down a tree and we put it in our living room. Kind of sounds like the behavior of a drunk man, really. Some woman wakes up, honey, why is there a pine tree in our living room? I like it. We're gonna decorate it for Jesus. And then I'm gonna hang my socks over the fireplace. Fill them with candy. Maybe I'll tie some leaves to the ceiling, see if I can get some action.
The Voice of Health Minute with Dr. Robert Prather of the Prather Practice.
I had this one gal who came in, and I've seen this quite a few times. It was just like, you got all these bruises, she says, yes, my husband does not beat me.
That's good.
She said, ever since I had my third child, I've had this. She said, I also got all these spider veins, and she said, everything kind of went downhill. I blame that child a lot. And he's ornery, too. Which doesn't help. But one of the things that we saw is that she had a vitamin K deficiency. So got her on some vitamin K, and it really just made a big difference on that. One of the interesting things is she also had quite a few headaches. And the headaches also responded very well to the vitamin K. And you can even get bruising up into the head, and that can actually kick off some headaches. So the integrity of the body is very important.
Schedule your appointment at the Prather Practice, 317-848-8048. The Prather Practice, restoring hope. A special message from the DTS Weight Loss Center at the Prather Practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation, plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, succeed.
Have a holly jolly Christmas. It's the best time of the year. I don't know if there'll be snow, but have a cup of cheer. Have a holly jolly Christmas.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about the epidemic or pandemic of diabetes. And Dr. Prather, does diabetes affect life expectancy? I mean, I know the answer is going to be yes, but how does it?
It does. One, of course, cardiovascular disease is the number one killer. Number two is cancer, and we do have an increase of both of those. Neuropathy is becoming much more of a problem because people start to lose toes and then hands and fingers, so yes. As it starts to come up on that. But yes, millennials are the first generation that aren't going to live as long as their parents.
Yeah,
so
that's sad.
We're heading backwards on
life
expectancy, which is the first time since that there's been a decrease since the 1930s.
Wow.
So and that was just a very temporary one because of the Great Depression. But always throughout the entire American history, people have been living longer than their ancestors, except now. And one of the biggest culprits on that, is the obesity crisis and the drug crisis. Those are the two things that have really made a difference in the health of America, and it's something that has to be addressed. And neither one are being addressed at all. There's a lot of talk about it. There's a lot of politicians who get up and say, this is a crisis. Let's make a special committee to look into it. But all the things that they're doing, all the policies that they have, all make the whole situation worse.
Well, you even say on the CDC, it talks about the treatments that need to be tried before drug intervention.
Correct.
but it's not happening.
Well,
it's not changing.
Sure. They say, okay, this is what needs to be done, but then they cut all reimbursement to the things that they just said need to be done, and then they provide more reimbursement for the things that they said shouldn't be done. So they say, don't do that, but then they give you money to do it and take away what little that they were doing.
Yes.
So, it makes no sense. What they say that they want to do and what they're doing are two completely different types of things. And the federal policy is just, shall I say, absolutely insane. And the insurance reimbursement is absolutely insane to achieve health. And I don't know how to put it any other way. The only thing that you can say is that they don't want us healthy. Because all of their policies are to create unhealthiness. And they know what to do. I mean, the things that the Center for Disease Control, World Health Organization, all the research is coming out, and they say this is the answer on how to fix it. And they do just the opposite.
They take the reimbursement away. Yeah.
Yeah. So it's very
decrease the reimbursement.
It's maddening.
And people are having to pay cash to get those things done.
Right, and still having to pay for the insurance that still keeps going out the roof. Then they're not paying for the things that. It's a whole catch-22, and it's very hard to fight the federal government to make things because they set the policies. They have so much control.
And then there's the politics.
Yep.
All right. Well, that's a whole other show.
Yes. Don't get me started.
So, what diagnostics are needed for diabetes?
Well, blood test, urinalysis are the basic types of things to show up if people are positive on diabetes. There are several different types of sugar tests that need to be done, just blood glucose, hemoglobin A1C, glucose tolerance tests. All those things should be done, but also when you're talking about that diabetes is established, there's a lot of other testing that needs to be done too. You need to do the lab tests to determine what things need to keep the free radicals under control. You need to be looking at mineral balance. So hair analysis is extremely helpful because the balance of the minerals makes a big difference in the diabetes. They're looking at the gut because the gut has a huge effect on that, on whether we actually develop diabetes or can reverse it. One of the things that we look at is fiber. We can tell how much fiber you've been taking into your diet. People used to have a balance between two different types of bacteria in their gut that showed that they had high levels of fiber as opposed to the carbohydrates. And so it should be 50-50. The average American has about 98% to 2% now.
Wow. And it was 50-50.
The average. It used to be 50-50. So our whole gut flora, our whole gut way of working has completely changed, and it's all designed to make us fat. And it also leads to type 2 diabetes. I mean, I've never seen a gut flora that had a 50-50. Matter of fact, I've never even seen someone's gut flora hit 20-80.
Oh, really?
Yeah.
Anymore or ever?
Well, I mean, we sit there and almost everybody is 2 to 3% or less.
Wow.
And we get it up to about 20% on a consistent basis. But even then, we can't seem to get it over that 20% mark. Just because what it takes for people to do that, there's the stuff that we're eating, the stuff that is produced by our food industry is killing us. And it didn't used to be that way. In other words, when we really had real food, it wasn't that way. So how this has all occurred, it's hard to say. And with the gut flora, we can also see how the pancreas is working, to produce the enzymes that are necessary. In other words, the gut tells us a tremendous amount of what's going on and has a very direct effect on diabetes. So those are all different types of tests that are absolutely essential in the treatment and the control of diabetes.
And we do those at the Prather practice.
We do.
And let's talk about the type of care we offer at the Prather practice, the structure function care. And if you've been a radio listener for a while, you understand that because we talk about that. So how does structure function care differ from disease care model with diabetes?
If you have to go into the pharmaceutical, the disease care model, then you failed on your diabetes. Diabetes type 2 diabetes, now not type 1. Type 1 actually requires pharmaceuticals. Type 2 diabetes does not. It is something that has to be dealt with structure functionally to be effective. That's why we are so ineffective with type 2 diabetes, is because we don't have structure function care as a part of our national health care system. All we have that's supported by the federal government and pushed forward is the disease care model, which is totally worthless, as I say again, worthless in type 2 diabetes and really getting that under control. So structure function care, we always say that as we're looking at the disease, the whole healthcare industry, 80% of all care should be structure function care, 20% should be disease care. When you're talking about diabetes mellitus, it's 98% should be structure function care, 2% should be disease care. And that is why everything, the Center of Disease Control says, hey, we've got to get this under control. We've got to get this under control. What drugs do we use? Well, it's not that type of a problem. You have to go structure function. No wonder it's a failure.
Well, let's talk about the under structure function care and what we practice at the Prather practice, the different treatments for pre-diabetic and diabetes. Let's start with herbals. Can herbals be effective with diabetes? Herbals
are amazing for type 2 diabetes. So there are several different things that can be done. Aloe vera, excellent for taking down hyperglycemia. Taking it internally, it's also excellent for any type of wound care. Remember, there's a lot of problems with the skin, and we've had amazing results with aloe vera on the topical. Bilberry, excellent for the free radical pathology. There's something called bitter melon or balsam pear, and it really helps tremendously with the glucose tolerance. It's a gradual and cumulative type of a thing. And then there's Coxsackie indica. It's an Ayurvedic herbal that is very, very excellent on helping with diabetic situations. Fenugreek, one of my favorite, and one of the things that works the best on me. Also, we use that for you. You were starting to develop some type 2 diabetes. Well, I mean pre-diabetic, a little bit at that, very low level. And fenugreek, or Greek hay is another term for that, really helps to bring that under control. And one of the best ones that I use and you use to control that. Garlic and onion are excellent for diabetes. Ginkgo biloba is excellent for peripheral artery diseases, so keeping that going, especially for preventing peripheral neuropathy. Gymnema sylvestre, it works on both type 1 and type 2 diabetes. One of my favorite ones for diabetic situations, and very, very excellent. And then also inulin. And inulin is found in burdock root, dandelion root, Jerusalem artichoke, and it's excellent for taking down hyperglycemia. And then there's prickle pear cactus, which has been used for a long time in Mexico for type 2 diabetes, and excellent along those lines. We've had quite a few patients who were able to get off of medications for their diabetes. By using the prickle pear cactus. Grapeseed skin and pine bark, those are excellent for free radicals. and those really can help out quite a bit on getting down the peripheral neuropathy. So free radicals has a lot to do with that.
So you find herbals very effective.
We really like a lot of the herbals, and we can get some really great results off of those.
Okay, when we come back, more on more structure function care for diabetes. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. How is TMJ treated at your office?
One of the most important ones is actually some jaw adjusting. The technique that I actually use, I invented. It needs to be extremely light adjustment. If you come in hard on the jaw, it's a very mobile type of a joint. So the angle, the pattern, and just the amount of right pressure, it's a very gentle type of thing. As a matter of fact, people just sit there and say it's sort of like a puff of air. You know, I mean, did you actually do anything except, you know, all of a sudden all their pain's gone.
Yeah.
Matter of fact, the TMJ is one of the major causes of headaches. There's a different pattern if it's cervicogenic and jaw on the headaches. By the time just we do the consultation, I usually know where the headache's coming from. It also has a very strong emotional effect. There's actually a direct nerve that goes right to the brain from the jaw that goes directly to the emotional center in the brain. The emotions can affect the jaw, and then the jaw can affect the emotions. Jaw problems of any type of musculoskeletal pain, people commit more suicide from TMJ. About 80% of everyone's going to have TMJ sometime in their life. And many times people aren't even aware that that's where their problem's coming from. One of the things that you have to do is the neck has to be fixed to be able to fix the TMJ. If you don't get the top bone called the atlas fixed, you'll never be able to fix the TMJs.
And that's something you do. Your specialty is the atlas.
We actually have a specialty on that. So, but you can have TMJ problems and not have a neck problem too.
Okay.
But if the atlas is out, you're going to absolutely get nowhere with a TMJ. There's also a global type of a shift that occurs. The pelvis will actually shift. We've had people with elbow problems. We've had people with shoulder problems. And I said, it's coming from your jaw. And they're like, you know, well, it doesn't hurt up.
How does that happen? Yeah.
And so I go up there and adjust their jaw, and I recheck their shoulder and the elbow, and I said, does that hurt anymore? And they go, no. Oh my gosh. I've had people working on this for 2 years and never gotten this far, and you do it in just like 5 seconds. Examination and diagnostics are absolutely so essential for really understanding a problem. If you don't know exactly what's going on, if you don't know what the cause is, then you can't fix it.
Right. And when you know, it makes the treatment easy.
Oh, yes.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about the pandemic of diabetes. And Dr. Prather, we were talking about structure function care. That's what we do at the Prather Practice, and the different treatments for diabetes. We talked about herbals and gave a list of herbals. And this is something we wouldn't recommend someone just going out and getting. We test people.
Yeah, and we check to see exactly how that's working. So we know whether it's, we're getting the results or not. And we get very excellent results.
And then it's specific. Like one could work for someone where a different one could work for another person. So let's talk about one of my favorites is homeopathy. What role can homeopathy play in diabetes?
We have a list of about 200 homeopathics that are excellent for diabetes. Interestingly enough, the one that seems to work the best is carcinosin. But there are 3,000 listed homeopathics within the FDA. There's actually another 12,000 that are actually out there that are available. So, there's quite a bit of, but we have
3,000 that
are classical, right? And we have a list of 200 different homeopathics that can help out with diabetes. We have some that are pretty consistent along those lines, but what's great about homeopathy is they either work or they don't do anything. So they're very, very safe, especially on dealing with children. That's one of the things that we find is homeopathy is great for them.
Well, maybe that's why I like them so much, because I'm a child at heart.
There you go.
How does diet play with diabetes? What role does that play?
Diet is absolutely critical. There's several different factors that go along with diet. The one food that is the worst for diabetes? French fries.
French fries?
French fries kicks up blood sugar more than any other food. And causes more, and we like our French fries.
We do, us Americans.
So really cutting out on the French fries. The things that on diet, the fiber. We used to, the amount of sugar that we eat in our diet, the average American does about 60 grams a day. And we used to have 60 grams of fiber. And then we had about 10 to 15 grams of sugar, and it's reversed.
It's reversed now.
So we have to get our fiber in, and fiber is probably one of the best medicines for diabetes. Type 2 diabetes is oftentimes can be completely eliminated just by increasing your fiber up to the amount that you should be taking in. And it's also the only product that is known to consistently and always cause weight loss.
And, you try to get the fiber from your food, but also we provide fiber there at the office.
It is absolutely amazing. And because people took in a lot of fiber, that's why the gals had skinny waists. Was because they took in so much fiber. It takes your waistline down better than anything else. The other thing is looking at the glycemic index. We eat a lot of foods that are high in sugar, really reversing that. So diet is
glycemic.
Diet is absolutely critical. Fiber, and you can't really you have to deal with the diet to be able to, one, prevent and also to cure type 2 diabetes.
Let's talk about exercise. The importance of exercise.
Exercise cures a world of sins. And one of the things is that they find is as you exercise, it improves the utilization of glucose throughout the entire body. It seems to, one of the things that's a real problem is insulin resistance, where the cells can't take in resist the insulin from bringing in the glucose into the body. And insulin resistance, one of the best ways to get rid of that is through regular exercise, especially aerobic exercise.
And vitamins. How about vitamins?
Vitamins, one of the things is that vitamins don't seem to be something that changes the diabetes itself, but is extremely important to keep, because if you are diabetic, your utilization and absorption of vitamins goes way down, and your need for vitamins go up. So a lot of the damage that occurs throughout the body is caused because of vitamin deficiency. Now, it doesn't cure the diabetes, but it keeps you from getting the kidney disease. It keeps you from going blind. It keeps all those types of things from occurring. The nerve damage. That is where the vitamins are really, really important, is making sure that the damage from the diabetes doesn't keep on, making things worse.
Okay. How about the role of minerals?
Now, minerals, that does actually play a very direct result in the diabetes, especially chromium. Chromium is sort of like one of the magic types of minerals that really helps out with diabetes. But magnesium is the most common mineral deficiency in diabetes, but you also have to look at the manganese, you have to look at the zinc, the copper, and the phosphorus. All of those things play a very big role, and you can get some very excellent changes. And always looking at the chromium, because chromium and vanadium are two things that will definitely change the blood sugar levels.
Okay.
So minerals are very important.
So how can diabetes be prevented?
One of the things is don't get fat. We should be looking at what is the fat percentage that people are carrying. And for females, they shouldn't be over 30%. If you can keep your fat percentage below 30%, you probably aren't going to get type 2 diabetes.
For women. We're not talking about BMI, we're talking about body fat percentage.
Yeah, and it's different, because BMI, you can actually, we have a gal who developed type 2 diabetes, and she says, but I weigh 120 pounds, but she had 40% body fat because she had no muscle.
She was skinny, but she had...
Skinny fat.
So
we don't really care about your weight. What we do care about is the fat percentage. And what we do is we do a bioimpedance to find that on people. That's a much more accurate way. So BMI isn't really that important. What's important is your fat percentage, and the higher your fat percentage is, the more likely you are to develop type 2 diabetes.
Okay. If someone has type 2 diabetes, what steps should they take? And can it be cured?
Yes. You really need to find, first off, to find a doctor who's a structure function doctor, so that they can guide you through the whole process and what's going to be the best way to make the changes. And be willing to do the diagnostics. That way you can actually know what's going to change that, follow it, and find the best pathway to get where you need to be.
Well, and be willing. It's preventable. Be willing to do the work.
Right. Yeah, you have to put in some lifestyle types changes that are just normal types of no longer be sedentary, exercise, and then
Get
also
out,
eat
move.
correctly. And then finding out where your deficiencies are. You're going to need to have to take some supplementation, because you're not going to do it just through diet. And to be willing to get the treatments that are necessary to get you where you need to be.
So we have a minute left. Dr. Prather, what role should structure function care play in type 1 diabetes?
Type 1 diabetes? Well, type 1 diabetes, it's a supportive type of thing. When you have type 1 diabetes, you're going to have a lot of damage that occurs in the body. So you're going to need to take care of that. So type 1 diabetes, you should always have a structure function doctor involved, and make sure that the deficiencies are taken care of so that you don't have damage throughout the body. We've had people who we've been able to reverse eye disease, kidney disease, and get that, and neuropathy. And get that turned around for them.
Yes. So it's encouraging, because this is preventable.
Right.
And getting the right tests. So.
Yes, and type 2 diabetes is completely curable.
Yeah. Well, thank you, Dr. Prather, as always.
Thank you, Lisa.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.